Well, I guess he was contrasting that group of patients that weren't so complicated, that didn't have a lot of this psychosocial distress, like you to use the words that you were mentioning a little bit ago. And he was seeing that, gosh, all his skills that he was trained with was helpful in this group, but it was very unhelpful in this group.
Absolutely right.
Yeah,
absolutely right. And so I have no criticism of that perspective at all. But you've got to remember what he actually said. Peter actually said, I'm talking about those, not those ones, but these ones.
Sure.
Not CFT and do it to everybody.
Right. Yeah.
That's the big mistake that manual therapists, McKenzie people, Maitland people, chiropractors, osteopaths, everybody makes the same mistake. I've got a basket full of tools and I'm going to apply it to everybody regardless, because that's what I know.
Sure.
And right. Now, if you've just learned CFT and been impressed by Peter, and you would be, I don't doubt, all right, and you start doing that to people with lateral shifts, you're not going to do very well.
Right. Yeah. And I even used the example of a simple, elbow patient that didn't have distress and that showed a good retest response from some form of accessory motion along with extension or something. And he said, I'm not talking about those type of people.
Absolutely.
Type of people. So, right.
Yeah. And I would totally agree with him.
Yeah. So if we do think about the patients who don't show these simple, mechanical and musculoskeletal, tissue pathology type of issues that are fairly straightforward.
Not necessarily simple. They can be complex, but they can be still mechanical.
Okay, fair enough. Yeah, mechanical. But it does seem to be complicated by the distress and the social issues that are going on with the patients. What's a clinician out there? Do you feel like, from what Peter said, what should they really take home about that? What was he saying that you agree with?
The take home is that I think the real take home from Peter's watching Peter was that that you ignore the psychosocial at your peril. With people who are, you do the usual things and the patient isn't going to be better. If you're not measuring in some way the psychosocial status, sensitization / psychosocial distress, if you're not measuring that and taking notice of that and developing systems that can address some of those issues, then you're up the creek without a paddle. And I think if that's the takeaway message that I would take, and I would totally agree with that. It's a message that I've been preaching actually for a long time also. So we have a lot of commonality there.
Hear the entire episode for free on iTunes, Spotify, other favorite podcast players, or go to mechanicalcareforum.com.